Good afternoon. Earlier today, as you know, the World Health Organization officially declared COVID-19 as a pandemic. We have had, up to this point, 28 positive results in Florida. 26 of those have been Florida residents. 2 have been non-residents. 21 of the Florida residents have been diagnosed here in Florida. 21 have been diagnosed in Florida, but there have been 5 Florida residents diagnosed and isolated in other states, 2 non-Florida residents diagnosed and isolated in Florida, and we have had 2 patients pass away since this has started. A total amount of tests are 147 are currently pending results. 301 tests have come back negative. 877 people have been monitored for a 14-day period. 353 are currently being monitored. We had 8 new cases yesterday. 12 counties right now in Florida have a patient who is tested positive. It's important to know with those cases and many of the cases in Florida, we issued an advisory, our health department, on individuals who traveled to Egypt and took a cruise or a tour on the Nile River in February or March of 2020. The instructions were to self-isolate for 14 days following the return to the U.S. We've had several passengers, not just in Florida but in the U.S., have recently developed symptoms and have been confirmed to be infected with COVID-19, including, of all the positive cases in Florida, 10 of the positive cases have stemmed from this travel on the Nile River, and then 5 of the 8 new cases the Department of Health announced yesterday was connected to travel on the Nile. It was we had the individual who passed away in Santa Rosa. His travel had been to the Nile River, and it was somewhat of an isolated case of travel. Then we had someone else test positive who had also been there. So our health department talked to CDC. CDC noticed there had been other cases, and so then once it was figured out, hey, this probably was a problem, then the Florida Department of Health issued that guidance, and I think these positive cases were as a result of that alert going out. We do have the 4 individuals in Broward County. We've linked 3 of those to Port Everglades. And so there's an epidemiological investigation ongoing with those cases, and obviously we want to get as much information as possible. So we did declare a state of emergency on Monday. That's allowing Jared's working hard to procure different supplies, line up personnel if we need it. Allows us to bring in potentially people from out of state, which is good. Today we're announcing a further effort. I've directed Director Moskowitz as the state coordinating officer to temporarily prohibit visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes. And so these are the following individuals who are going to be temporarily prohibited from visiting these facilities. So any person infected with COVID-19 who has not had 2 consecutive negative test results separated by at least 24 hours, any person showing or presenting signs or symptoms of a respiratory infection, any person who has or may have been in close contact with a person infected with COVID-19 who is not tested negative is prohibited from visiting a facility for 14 days from their interaction with the infected individual. Any person who's traveled internationally is prohibited from visiting for 14 days subsequent to their return to the United States. Any person who traveled on a cruise ship is prohibited from visiting for 14 days from their return. Any person who's been in a community with confirmed community spread is prohibited from visiting for 14 days once they've exited that community that's been effective. And then any person who physically resides in a community with confirmed community spread. So these are important efforts to mitigate the risk to our most vulnerable population to COVID-19, which is our elderly population, and particularly those who have serious underlying medical conditions. As many of you know, this afternoon, the state university system announced our state universities would take proactive steps to mitigate the risks involved with our universities. And so you had universities where students were coming back, have been told, wait another 2 weeks, and then folks who are going to be on spring break are told to to wait as well. So I think that those were prudent steps. I think because you have the ability to do distance learning, they'll be able to do that and not miss a huge beat, and they're going to continue to monitoring the situation and then make the best decisions that they can. And so I think that those were prudent steps. LabCorp and Quest, in terms of testing, have started testing individuals upon a doctor's orders, and the Florida Department of Health is identifying strategic CLIA-certified labs throughout the state to increase the state's testing capacity. So we're doing tests at 3 different state labs, Jacksonville, Tampa, and Miami. This would potentially, we actually have a lot of these labs throughout the states. The question is, we got to line them up, make sure they're able and willing to do it. And so that will add to the capacity in addition to the private sector. And then, spoken with some of the folks at the University of Florida. They're developing a test of their own. And this is something that will require the FDA to approve it, but they are working quickly, and the FDA is willing to work on a quick basis. And so that would potentially also enhance the testing capability. We're going to hear from Mary Mayhew, but she's been traveling the state, visiting these nursing homes. She's the secretary of ACA. She tries to get in. They're taking her temperature. They're asking her the questions. So they have responded positively to the guidance, which we very much appreciate. In terms of the election on Tuesday, Jared is working with Secretary of State Laurel Lee, who's also working with the local supervisors of elections. I mean, the election's going to go on. There are, though, in certain counties, sites where people will actually vote in an assisted living facility. And if it's the residents in the assisted living facility, obviously that's fine, but you actually have some of these sites where the general public will come into the ALF. We obviously view that as problematic. Now, supervisors have the authority to make those changes as they see fit, but our recommendation would be that if there's a polling location, assisted living facility, allow the residents to vote there, but maybe the general public should have the option or should be directed to go to a different polling location. And I think that there's ways to do that. And so Jared and Laurel Lee are working with the local folks, but I think that that's a prudent step to take. So we're continuing in our efforts. We've been working with a lot of different folks throughout the state. I mean, you got a lot of people at the municipal level working very hard. Obviously, we have county health departments in all 67 counties. The private sector has been very responsive in working with us constructively on these issues. And then we've gotten great feedback and work with CDC and the folks on the coronavirus task force up in Washington. So we appreciate everyone that's been involved. And obviously, we're going to continue. We do not have, I spoke with Director Redfield and Dr. Fauci last night. Florida was identified as one of the 4 states, and it was said that there was, quote, community spread. We discussed, because that 3-person cluster in Broward can all be linked to the cruise ship, that technically doesn't qualify as community spread, which would be multiple people who we don't know where they got it from. And so we haven't necessarily gotten to that point yet, but we were cited as one of the states. We were number 4 for infections, but we were pretty far below the top 3. But they cited us for taking some of the mitigation steps that we're doing. And so we're working very hard to isolate the cases as they come in, contain the spread throughout Florida, but also taking steps to mitigate any potential damage if you end up having a situation where you do have verified community spread. And so with that, we're going to have this Surgeon General say a few words, Secretary Mayhew, and then Director Moskowitz. So.
Yeah, thank you, Governor. First, I really wish to emphasize that people continue to understand what COVID-19 is. This is a new virus that you can think of like the flu that can attack the lungs, and if it attacks the lungs of individuals who are elderly or have underlying medical conditions, they can be particularly affected. Increasing information is coming out showing that this is more severe than the flu, particularly for the elderly population, where the mortality rate can be 20 to 40 times more than with the flu. Again, because this is like a flu-like illness spread by coughing, the protective measures are what we'll continue to emphasize. Cover your cough, stay at home when you're sick, stay away from individuals who are ill, and continue to wash your hand. In terms of what our plan is at the state level, two major strategies: containment and mitigation. Containment means that if we identify an individual who has COVID-19, that we make sure that individual first has the health care that they need, and that their contacts are isolated. By having the isolated contacts, this way will stop community spread. As the governor mentioned, if we look at the individuals who have had COVID-19 in our state, with the exception of a few individuals, just about everybody, we can actually link their exposure back to either international travel, a cruise, or contact with somebody who has COVID-19. As the governor mentioned, we are not seeing community spread, but this is something that we are watching very, very carefully. Again, I really wish to emphasize the importance of public health measures, which are found on our Department of Health website. Again, cover your cough, stay at home when you're sick, frequent hand washing, and staying away from individuals who are ill. Thank you.
Mary?
Thank you. As the governor mentioned, I have been traveling our state this week to assess the needs of healthcare providers across Florida and to hear the challenges they are confronting on the front lines. Facilities across Florida are taking every precaution to ensure the health and safety of patients and residents and protect the welfare of their healthcare staff. We know the most effective way to protect Florida's most vulnerable residents is to prevent the infection or those with symptoms of an infection from entering the facility. The first line of defense is vigilant screening of visitors, vendors, and staff. As the governor mentioned, as I have been out in facilities, I have had my temperature taken, I have answered all of the questions, and I have been prepared to be comprehensively screened. No one is exempt from the screening. Every provider I have visited has been unequivocal in their support for and implementation of these screening protocols. And every facility must have the necessary tools at their disposal to keep patients and residents safe. That's why this executive order is so critical. I want to thank Governor DeSantis, Surgeon General Rifkes, and Director Moskowitz for their leadership while the state faces this public health emergency. Today's executive order will help ensure facilities can take necessary measures to protect Florida's most vulnerable populations. We've seen the tragic situation in Washington State and a nursing home there. The choice is clear. Florida will and must take every step to prevent real and potentially fatal threats to our elderly and senior populations and those with underlying health conditions. This executive order is formalizing many of the precautions we have already asked nursing homes, assisted living facilities, and other residential providers to take. Healthcare providers across Florida have the full support of this administration to put up a strong line of defense against COVID-19 in our communities. Beyond this executive order, my agency has had a laser beam focus on those who are most at risk for infections, and we remain in constant communication with Florida's skilled nursing and assisted living facilities and their statewide associations. My agency has a clear and determined focus on ensuring the safety and welfare of hospital, nursing home, and assisted living facility patients and protecting the healthcare workforce caring for them. Healthcare providers are executing their infection control procedures, which they are required to maintain at all times. Hospitals and nursing homes plan, train, and drill on infection prevention and control precautions. These protocols are ingrained in their standard operating procedures. Additionally, my agency has taken decisive action to visit all hospitals, nursing homes, and assisted living facilities that have had issues related to infection control and prevention. Any deficiencies that we have identified in the last year, we are prioritizing on-site inspections and visits. These visits will allow my agency to focus our efforts on addressing the spread of COVID-19 and to ensure adherence to the infection prevention and control protocols that we expect. Again, I want to thank Governor DeSantis for his strong support in protecting Florida's nursing homes, assisted living facilities, and other residential providers. Thank you.
Thank you. Governor, thank you for your leadership in our response to COVID-19. Thank you for taking these proactive, preventative measures. As you know, the governor declared a state of emergency, which helped set up a unified command structure between the Division of Emergency Management, the Department of Health, and all state agencies. At the Division of Emergency Management, we have been working for the last several weeks on planning on multiple contingencies, and we are now starting to get resources, the necessary resources that we need to go and act those plans. We are following the comprehensive emergency plan here in the state of Florida. Year after year, we train for all sorts of different situations like pandemics. And so we are following that plan. My folks are working around the clock at a level 2 at the Emergency Operations Center. I want to thank all the state agency heads that are here today and that are working on this issue in a collaborative, unified effort. And so everyone at the division will continue to try to be ready for every contingency and have the necessary resources. And I just want to thank the governor again for taking these proactive preventative measures.